Welcome to Health Disruptor, Connecting Healthcare Innovators, Episode 2.5. About us. Health Disruptor's mission is all about connecting different kinds of healthcare innovators and consumers to stay connected on new ways of providing, supporting, and delivering care in what may very well be a new normal world. We are a team of experienced healthcare professionals who believe we need to explore, facilitate awareness, and embrace the unique and sometimes controversial innovators who will be key to the future of healthcare. Join us on this journey to explore the future of healthcare now. Episode 2.5, Telehealth Pilot Implementation for Provider Organizations. The purpose of this episode is to introduce you to a potential pilot implementation for your provider organization. The first thing you need to do is evaluate. Does your initial evaluation include evaluation of the program needs and the feasibility of pilot? Do you have the buy-in and support of key players in your provider organization? Have you developed an initial business plan? And have you developed an initial care services plan that will outline how you would deliver care and services to your members or enrollees? What is your technology plan? What do you currently have in place? Do you have a training plan for all personnel that will be involved in your pilot? And do you have a pilot launch date? And how feasible is this? Also, do you have outcome evaluation timelines? Have you looked at what point in your pilot do you need to evaluate outcomes and decide whether or not you need to make any adjustments or course correct with your pilot? Next, you're going to look at how your providers will deliver care. How will the services be scheduled and delivered for telehealth? What kind of audio and video equipment may be needed? What kind of technical assistance and or support are needed and coordinated with QI to determine outcomes? Will your providers need additional peripherals for any virtual exams? How will the scheduling be accomplished? Will you be able to integrate telehealth with any current scheduling system that your providers may have in place? And what kind of access will your providers have to patients' medical records prior to their virtual visit? Also look at what training or resources does the clinician and support staff need to make delivery of care effective and efficient. How will documentation of clinical services be achieved and made accessible to those in need of information? Will there be any EMR interface? And finally, what are the options and methods for billing? Because at the end of the day, you need to make sure you can do that and get paid for services. Develop a business plan and do an initial risk analysis. Determine projections of cost and revenue sources. Set financial milestones for the duration of your project. Determine any additional staffing needs as program volume may increase and what the impact to cost and revenue projections may be. Determine the cost of adding any new administrative, clinical, and technical staff. New equipment and software cost, what will they be initially and ongoing? Look at initial and ongoing cost of training new and existing staff throughout your pilot duration. When developing your business plan and doing initial risk assessment, continue to look at additional costs of any expanded network bandwidth needs. What do you currently have in place? And what will you currently need to move forward with this pilot? Are you going to need any additional software security systems to implement your telehealth pilot? And will you need any additional liability insurance coverage? Does your current insurance currently cover telemedicine visits? If not, you'll need to add those to your current policy. And what is the impact of decreased patient visits to any bottom line revenue? Will this be impacted? Will it hurt or help your revenue stream? That needs to be determined. Training and education of staff. You'll need to look at developing a plan for training personnel to prepare them for telehealth. No doubt this is a new pilot for them, and telehealth may be new to them. So anybody involved in touching this pilot throughout your organization will no doubt need to be trained. How will you conduct operational training for physicians, other relevant providers, and clinical staff and/or patients? They will all be impacted by your pilot. Therefore, some sort of training will need to be provided for all that will be involved. Consider using system and protocols with a mock patient to benefit the end user staff. So what we mean by that is you may want to record your training, you may want to provide some recorded modules, but a safe environment for your staff to practice so that they feel comfortable when your project is finally implemented. What SOPs will you incorporate for backup in the event of any technical failures of the system through either equipment malfunction or user error? So potentially you'll want to look at a plan B. How will you do a system-wide training for any potential referring providers about the role of telehealth in the organization, including the value of the program, the benefits of the program, and relevant protocols? So consider what kind of training you're going to want to develop for any referring providers, not just your key hands-on staff. Training administrators and/or provider office staff about the services that will be offered and their benefits. Maybe they won't have direct intervention responsibilities with the pilot, but they will be impacted. And we'll need to understand why you're doing this pilot, what the services are that will be offered, and the value. What other staff will you include to assure successful implementation and outcomes? You want your entire organization to support this pilot and to be an advocate for it. So you want organizational buy-in from top to bottom. Pilot the program. Both the care and technology plan should be tested by performing a pilot program with a limited number of patients and staff members for a limited duration. So before you do a full launch, maybe look at a select study group to pilot first. How many providers and what representative patients will be used for the trial? How long will that run? Will you include attempts to obtain reimbursement for the pilot efforts? What kind of inputs from the experience of providers and patients do you need to guide for optimization of the operational clinical protocols? Maybe you want to look at lessons learned. After you run your trial program, how did it work? Was it successful? What didn't work? What were your lessons learned? And how will you incorporate that when you do a full implementation launch? Does it appear from initial pilot results that providers, clinicians, and support staff will need additional training with equipment and protocols? Do you need to extend the pilot further to get more outcome data? These are all things you'll want to consider before doing a full system-wide launch. Next, and most importantly, you're going to want to evaluate outcomes. Is it possible for you to collect information daily on the quality of the system performance so that technical services staff can detect and address system problems in a timely way? Additionally, how can your program monitor and detect errors in the use of the system that could be addressed and resolved in a timely way with targeted staff training? What goals and performance standards underlie the telehealth program, which calls for clinical measurement efforts? And how can you garner input from providers and patients on perceived benefits of the program for delivery of services without undue burdens of time and effort on both parts? Can existing data collection for your EMR and the quality system built on it serve to reveal the impact of telehealth services with minimal modification? For instance, a code field for telehealth? How will data on patients served with telehealth be compared to usual and past care? And how can your assessment consider the extra staff efforts required for the program so organizational cost benefits may be estimated correctly? Thanks for viewing episode 2.5. Resources, Telemedicine Adopt Toolkit, Honor Hagel 2020. Contact healthdisruptor@gmail.com for full toolkit program materials or virtual consulting requests. www.healthdisruptor.com website is currently under construction, so please contact us at the email above. And coming soon, Episode 3, Telemedicine Program Manager Interview. Thank you again for viewing Episode 2.5.